The primary focus of the Skin Cancer Treatment Center is going to be the diagnosis and excision of skin cancers. When I moved my dad up into a local retirement facility, I noticed a couple of places on his legs, and I thought, well, we need to get those seen. So I called around to dermatologists, even some of which were my friends. And the shortest amount of time it was going to take for me to be able to get him to be seen was 3 months. And I felt like this was completely unacceptable. And the longest time was 6 months or more. If the need for skin cancer treatment is in that much demand, then let's do it, and let's do it right. And let's see you quickly. Let's take care of you quickly. Let's give you a better scar with a better outcome, and do it in a much more timely manner. Our goal is to be full service. If you have something that you want taken off, you come see us. We plan on seeing you once you call our office within 3 days. We'll get a tissue biopsy of the lesion, and once we have a diagnosis, then we will have you back within 3 weeks to excise the lesion. But let's say you have a lesion, you don't know if it's cancer or not. You come in and we don't know if it's cancer or not. Our role is not going to be to guess what your lesion is, since a lot of times the guesser is wrong. So we're going to take a piece of it. We'll send it to the pathologist, the dermatopathologist, who will look at it under a microscope. They'll be able to tell us, usually within 5 days, what it is. And then we can schedule a time to excise it in an appropriate manner. One of the things that I noticed, particularly in my travels in Florida, where skin cancer is very prevalent since they have two things, a lot of sun and a lot of elderly patients, is that the dermatologists, when they excise something, they basically take a pitching wedge and take a divot out of your skin, leaving a hole that has destroyed the architecture of the lesion. And the only true purpose of doing it this way is for speed, not necessarily the best thing for the patient. Well, we're not going to do that. We're going to excise it surgically with the clean margins and plastic surgery closures with minimal scars. There'll be no holes left on you. We're not going to burn things. We're not going to laser things. We're not going to freeze things. We're going to excise it surgically, give you the very best scar we possibly can. Our goal is to change the way skin cancer is treated in the state of Arkansas.